On the topic of obesity, the impact on African Americans is significant. Did you know that compared to non-Hispanic whites, African American adults are more likely to have been diagnosed with diabetes, or have a limb amputation, or even die from diabetes? Why? And what can we individually do about it? Grab your pen and paper. Take a note for healthier living.
My dad was in the Air Force for 26 years. When I was applying for scholarships, we came across Thanks USA, which helps military children earn scholarships towards whatever university they want.
Education gives you the chance to find the nexus between your unique passions and gifts and the needs of the world around you.
You realize that ripple effect, that you give them an education and they're going to take it and run.
Hello and welcome to the Clarion Call Show. I'm Janice Hatcher-Liggins, your host. There's a lot of discussion about obesity in the African American community, and many of us know someone who is obese. Many of us also know someone with diabetes. Is obesity and diabetes, are they connected? How prevalent is obesity in the African American community? How do we get to this point? Joining us to help us understand the causes and complications of obesity is Dr. Rodney Ellis, Doctor of Internal Medicine and Bariatrics with Rosebud Physicians Weight Loss. Dr. Ellis studied at Stanford Medical School and completed his training in internal medicine at Johns Hopkins Hospital in 1978. He also became board certified the same year. Dr. Ellis has clinical, administrative, and medical director experience. He now focuses his efforts on bariatric medicine, in which he is also board certified. Dr. Ellis, welcome to the show. We appreciate you coming on.
Thank you for having me.
I am very happy to talk about this particular topic because it touches home for me in a very, very personal way. The topic of obesity, yes, and then diabetes, because I just lost my sister Thanksgiving Day because of complications of obesity and diabetes.
So sorry to hear
So if we can share some information,
yes,
with other viewers so that they can avoid that kind of a ending,
absolutely,
then I'm happy to do that. So again, thank you for coming.
Sure.
So you're board certified in internal medicine, and since 1978, was it?
Correct. And since then, for a good number of years, I just practiced as an internist. And internists are primary care physicians who take care of the common things that adults have. And the common things in our society include things like diabetes, hypertension, high cholesterol, neck sprains, back sprains, colds, more serious illnesses when someone has an abdominal pain, for example, that needs to be investigated. Internists are seen as people who can investigate. So primary care, which was what I did for many, many years, and what I found was that much of the disease that I was seeing was related to people's weight and their obesity. What they were putting into their bodies and what they were doing with their bodies. So after a number of years, I'd say now a good 13, 14 years ago, I decided I wanted to get more information, more knowledge about bariatrics. Now, bariatrics is the study of weight. Bari comes from the Greek, bari, weight, and trix is the science of something. So pediatrics is the science of children. Geriatrics, the science of the study of elders. But in bariatrics, our focus is really on what are the causes of obesity, how do you treat obesity, and how do you relate the treatment to the presence of diseases that are associated with obesity, because when people lose weight, their medications change, for example. So there's a useful relationship between internal medicine and bariatrics. Now again, this is the work of talking, the work of prescribing medications. This is not bariatric surgery. I do not do bariatric surgery. That's a different specialty. You would have been trained as a surgeon to do the different kinds of surgeries. But we do, if you will, the medicine part of bariatrics.
Okay. So is obesity considered a disease?
Nowadays it is considered a disease. It used to be kind of looked at as like something's wrong with you psychologically, or you're too weak, or you have poor willpower. But now bariatrics is I should say obesity is looked at as a disease that should be approached as a disease. It's multifactorial. It has biological. It has
multifactorial,
meaning it has psychological issues. It has physical and endocrinologic, in other words, hormonal issues. It has a lot of cultural and societal, socio-economic issues. So it's a complex disease that can cause a lot of different, what we call comorbidities, which means different kinds of diseases that go with it.
Is it considered, we're hearing more and more people talk about obesity and it's how prevalent it is. How prevalent is it?
Well, obesity in this country is, first of all, growing in incidence. Right now, we see approximately 60% of American adults as being either overweight or obesity. And by the way, the technical way to define obesity depends on the body mass index. It's a simple measurement. We just simply get your height and your weight, and we make an index from it. The height has a little more disproportionate effect. So the taller you are, it's easier to have a lower body mass index. But essentially, when your body mass index is between 25 and 30, you're considered overweight. Above 30, you're considered obese. And a doctor can do that very simply with a weight and a height in their office.
So are we at the point in the United States of obesity becoming an epidemic?
I would say it is. It's been an epidemic for a while. And to define an epidemic, it's really both the consequences of it, about the number of people involved, as well as the rapidity, how rapidly it's occurring. And we've seen a consistent increasing rise in the prevalence of obesity in the society. So because it has such huge consequences on the health care of Americans, and really not just Americans but around the world. It's not just a problem in this country, by the way, it's a problem around the world. Because it has such consequences, it is an important epidemic.
It's interesting, if it's around the world, it's, from what I read in preparation for you coming on, their comparisons were non-Hispanic whites, African Americans compared to non-Hispanic whites. And the rates were much more significant for those African Americans. Why is that, even though it is a worldwide challenge? And why is it so high amongst the African American community?
Again, it's a complex answer, if you will. We think that amongst African Americans, in our culture, there's less ability, and in our society, less ability to have access to recreation and exercise, for one thing. There are so-called food deserts more often in African American communities. In other words, a lack of really good food markets where you can get affordable fresh fruits, fresh vegetables, adequate food. And I think it's a socioeconomic and educational phenomenon. People who know that you shouldn't eat certain kinds of sweets and certain kinds of carbohydrates and not exercise, people who know that are less likely to be obese than people who don't have that knowledge. So again, our people die, if you will, for lack of knowledge, perish for lack of knowledge, I think the Bible tells us. So the knowledge is very important, and that to me is often a socioeconomic issue. And as you know, we African Americans continue to have difficulties in that area.
I was speaking with someone and I was telling them that we should eat to live and not live to eat. And this person had a few more pounds than what they needed to have, and they said, "Oh no, I want to enjoy my food." So how do you change that kind of a mindset to people so that people do understand that they should think more about what they eat to live rather than just live to eat?
Well, thank God for you in this show, for one thing. It's about knowledge. It's about getting the information out. I just came from a funeral today, and bless her heart, what people were talking about was how good she could make sweet potato pie. And unfortunately, she was overweight herself. Not that that was a cause of her death, but our culture, the African American culture, is so one of celebration and enjoying the taste of food. I think that's one of the cultural, if you will, components of the obesity epidemic in African Americans. And the kinds of foods that we like are oftentimes indeed heavily laden with carbohydrates and sweets, or fats, the fried foods, which are going to be higher in calorie count. And in order to change that, we've got to continue to get the information out. We've got to tell people and show people how to have good, tasty food that's healthy and not going to lead to obesity. We've got to instruct people about the importance of movement. Our beloved president and former president now, and his wife, President Obama and First Lady Michelle Obama, were so good at trying to show the importance of movement in our children, movement in everyone, and to burn up calories and not have them end up stuck onto you.
Right. So what is the connection between obesity and diabetes?
Very good question. So when you put on excess fat, there's something that occurs in your body called insulin resistance. Now, not to get too technical, but insulin is a hormone that most people have heard of, because when they hear about diabetes, they hear about insulin. Well, in most diabetics, their bodies actually produce insulin, but the insulin is not working so well. What makes it not work so well is the presence of fat in the body. The fat cells cause insulin to be not working well. Wow. So what does the body do? It tells the pancreas, well, put out more insulin. And guess what the most powerful hormone is to cause fat accumulation and to prevent you from burning up your fat? Insulin. So if a person has already insulin resistance constantly in their milieu, in their body, their levels of insulin will always be up. And therefore their tendency to accumulate fat and not be able to burn the fat up is constantly there. So if you can, oftentimes just losing weight will reduce your incidence or your likelihood to get diabetes.
And so I know that diabetics constantly have to either prick their finger to take the blood, or in my sister's case, she was actually giving herself injections in her tummy. What do those are measurements of some sort, I'm sure, but for what? So
the difficult thing about diabetes is that it tends to cause high blood sugars because the insulin's not working well. Well, high blood sugar is toxic to your nerves and to your blood vessels, especially notable to the blood vessels to the eyes, the blood vessels to your heart, to your kidneys, to your brain. And so therefore you get the blindness, the stroke, the heart attack, and the kidney failure that comes from diabetes. In addition to the fact that it's toxic to the nerves, where people have numbness and tingling and those kind of sensations too. So we don't want the blood sugars to be high. For that reason, we oftentimes have to give supplemental medicines to lower it. In order to make sure it didn't go too low or to see how high it is, you have to test your sugar frequently. So that's why diabetics are frequently checking their sugars, because they want to make sure the medicine's keeping the sugars down. The difficult thing about diabetes is that we don't want to keep giving them more and more medicine to keep those insulin levels high, because that works against the ability to lose weight. Wow. So I tell diabetics you have to walk a tightrope. the tightrope being don't let your sugar get too high, but also don't take a lot of medicine to make the sugar go down too low, because it'll make you hungry and you have to eat more. And if you eat more, you're going to keep the weight on.
Wow.
So it's a tightrope.
It's a tightrope. We're going to come right back to it. Hold on. So what can we do individually to get on a better health track? If you are obese or have diabetes, what can you do to help yourself? That's next. Stay with us.
It takes less than 1 minute to find out if you may have prediabetes. You can do it here. But you probably won't. You're busy. Kids, work, show coming back in 48 seconds. So let's do this now. Hold up one finger if you're a man, women, 0. 3 more fingers if you're over 60, 2 over 50, 1 over 40. If you're not sure, keep in mind you're sitting on a couch right now, so 1 more finger if you're not very active. 1 finger if yes, 0 if no. 1 yes, 0 no. Next, find the body type that looks most like you and hold up that many fingers while I look around awkwardly. And that's it. If you're holding up 5 fingers or more, you probably have prediabetes. Sorry to be so blunt, but hey, you're busy. Just go to the site.
Welcome back. So you have a diagnosis of obesity, or you've had a diagnosis of diabetes. And if not you, probably someone you know. What can be done to turn the tide? With us again is Dr. Rodney Ellis, Rosebud Physicians Weight Loss Center, and joining us also is Ms. Hellen Beard, Certified Fitness Trainer and Program Director with Rosebud Physicians Weight Loss. Welcome, Ms. Beard, to the show. Glad to have you joining us, Dr. Ellis. So tell us a little bit about the weight loss side of your practice. Rosebud, tell us about Rosebud. What is it? How did the name come about, and so to speak?
Well, as I told you earlier, after many years of internal medicine practice, I realized the importance of obesity in the diseases that I was seeing. So I wanted to get more knowledge about it. And in thinking up a name for a separate practice for obesity, I came up with the idea of Rosebud because I think that obese people have layers and layers of fat that's hiding an inner beautiful person.
Oh, wow.
And to the extent that a rosebud is like that, with layers, with petals that are layers, that hasn't fully blossomed, we want to have our patients blossom into just good health. And so it sounds kind of feminine, but it's for men as well. It's for men and women. It's just the idea that a rosebud's got those layers.
And you do have men and women participating in the program?
Absolutely.
Absolutely.
Okay. So Hellen, I wanted to find out from you. You are program director for Rosebud.
Yes.
Tell us, as program director, what's your role?
Couple of roles. One is administrative, where I welcome those who are just simply hurting because of their weight. Second, I am the go-to person, if you will, for the sessions that require physical activity. And then third, I assist Dr. Ellis in actually coaching what we call the one-on-one or customized program participants to seeing real results.
Okay. So you plan the results that you want that person to achieve?
Well, actually, Rosebud has a formula. We take pride in what we do. So whether it's Dr. Ellis going to CEC classes, or me going to a fitness class, or any one of our other team of members of our professional team, we all contribute to the strategy for those who are struggling with weight loss, so that we're really putting forth the kind of information and the kind of program that best meets their needs.
So let me say, at the beginning of each visit, when a new patient comes in, we decide there what their program will be.
Okay.
You know, we do an initial evaluation because, you know, as adults who have obesity, frequently there are so-called comorbidities like the diabetes, like the hypertension, like the cholesterol problem, or knee problems, or ankle problems, or physical kinds of medical things that we need to assess. And then we also want to evaluate their laboratory tests, their cardiac exam, the EKG, in other words, to make sure their heart is healthy. And that will determine what kinds of appetite suppressants we may or may not want to give. So at the initial assessment, we determine what the plan will be, and we give some realistic expectations to the patient as to how much would be healthy for them to lose, how rapidly they should lose it, so that we become partners really in the effort.
Wonderful, wonderful. So you address their care from a medical as well as a physical perspective, because I know you're a fitness trainer.
That's right.
So how does that play in, the fitness part?
Well, a lot of folks who are hurting with diabetes are very apprehensive about exploring the possibilities beyond walking. And so resistance training may be an issue, but we show them how you can make it a seamless event when you know what to do and what, more importantly, not to do to protect the knees. For example, if someone came in for an assessment with a desire to increase their intensity, but they're having some musculoskeletal issues, one of the things that I would first recommend is aqua classes. Exercising in the water where their knees or their back is cared for, but they can still get outside of their comfort zone.
Good, very good, very good. So how important is exercise? I'm sure it depends on their capacity or ability, but generally speaking, is the aqua aerobics, for example, any more beneficial than if they're just going to jog or run or
Right.
walk?
Well, we coach everyone to do their absolute very best. And it's so ironic because just this past Saturday, I got a group of 12 individuals sweating in the chair, in 7 minutes.
Oh my
So
goodness.
it's not just what you know, it's what you don't know. And we're sharing with our participants what they
Nice.
just don't know.
Very nice.
Yes.
That's,
Let me add too, though. Exercise is important, but food is a bigger component, if you will, in the exercise, in the weight equation. So I like to tell people weight is a product of how much calories you're taking in and how many calories you're burning up. And whereas it's important to try and burn calories on a regular basis, and it's useful for a lot of other things, exercise is.
Like stress reduction.
But really want to focus also on the quantity and the quality of the food a person is eating. And when I say quality, we, believe it or not, both, even if you don't have diabetes or if you have diabetes, it's better to cut down on your carbohydrates and increase your intake of protein and healthy fats.
okay.
I say healthy fats because there are, plant-based fats. There, fish is a good source of healthy fat, and that's where you want to get your calories to burn from those kind of foods. And we counsel a lot on how to do that, and to do it affordably and to do it tastefully. And it's to just give some more information about Rosebud. It's comprehensive in that we even have cuisine experts who come in
Oh, nice.
and actually teach right in the classroom how to make a quick and easy but healthy meal that's low in carbs. We have a nutritionist who comes in, a behaviorist who comes in and actually works with people on how to change their behaviors, how to manage their cues, how to prevent themselves from getting into automatic triggers, which people oftentimes are unconscious about, but lead to their obesity.
It's interesting. I think it's excellent that you have a holistic approach to it in one, like a one-stop shop kind of a holistic approach, because I mentioned earlier that I lost a sister just Thanksgiving to obesity and diabetes. Well, I lost another sister years earlier, who was going to have surgery, and before she was very obese. Before she had the surgery, however, they had to put her on nutrients to get her healthy before they could even do the surgery. And I said to the doctor, but how can she not be healthy? She eats all the time. And he says, but it's what she eats.
Yes.
And so that goes back to the conversation we had earlier about eat to live and not live to eat. She was living to eat.
Yes.
And so having to adjust their thinking with the nutritionist and all like that is great, because it's necessary.
Yeah.
One of the advantages of Rosebud is that if you can get the head of the household to make those lifestyle changes, and that's what that's the ultimate goal, the lifestyle change, the whole family benefits.
Well, what you were saying earlier too about so many people have lost people from the diseases related to obesity. And this is again why I refocus myself, my practice, on getting to the source of the problem. The source of the diabetes, the source of the heart disease, the source of the hypertension. If we can get patients to reduce their weight, oftentimes, so many of these diseases go away and they live.
Well, it's, I think it speaks volumes for you to have been an internist for as long as you were and are an
Still
internist, okay?
Still am.
But for your focus to now be on bariatrics, you know, focusing on obesity and the complications thereof, that alone to me speaks volumes as to the degree to which we've gotten in our community and the urgency of a need to change.
Yes.
So kudos to you for being you know, having some foresight to be able to see it coming and realize that we need to do something. More importantly, in our community, in the African American community, we need to do something. That's two sisters,
Yes.
two of my sisters,
Yes.
who've been impacted. And so I'm happy to share as much as we can to, you know, I might come see you too, I don't know. So, but do you tend to see, is there an inherent danger for people who want to put it off, if they're afraid and they're a little reluctant to speak up, and, you know, what's the risk or inherent danger of not doing anything to address the obesity?
Well, it's really up to, I say, the good Lord to really know how long you live. But there's clearly risks when someone has chronic obesity, chronic inactivity, chronic diseases like hypertension, high cholesterol, and the diabetes. There are risks to shorten your life. And if you're not addressing those things, if you're not getting those things measured and looked at by your primary care physician or your primary care provider, then you are, I say, playing a game of Russian roulette.
Wow.
It's dangerous, and so many people, I think, know someone who unexpectedly died suddenly when they weren't expecting it. And they didn't anticipate it, that's just a better way to put it. And it hurts the heart of most doctors, I'm sure all doctors who went into medicine, to see someone die from a preventable disease.
Right. As a medical doctor, internist, specialist in bariatrics, what words of encouragement would you give to our viewers, in general about their health?
Well, I would say that, first of all, we are social beings. We human beings get support and strength from each other. So don't try and be a lone ranger and fix these kind of problems on your own. If you're strong-willed and do it, you can do it, and there are people who can do it. But for the most part, it's useful to have professionals who are trained to help you overcome some of these problems. These things are reversible. Everyone will see a commercial on TV that shows a before and after. Those people actually were able to have success because they made a commitment. You got to have a made-up mind. Once you've got a made-up mind and you have a support system that's professionally capable of helping you, it can be overcome. You can get great health.
Wonderful, wonderful. Thank you guys for coming on the show. I'm so happy to have you. We're going to have your contact information come up on the screen because we want to make sure that folk do reach out to Rosebud for that kind of help. Thank you so much.
Thank you.
Sometimes people have a hard time admitting or accepting that they have a weight or health challenge. Sometimes when it's our loved one, we have a hard time talking to them about it. But guess what happens when we don't talk about it? When no one makes the change, we all lose. Be bold enough to take the first step toward getting help. Be bold enough to have the conversation with your loved one for that healthy lifestyle change. Contact Rosebud Physicians Weight Loss to get started. You and your loved one will be glad you did. That's it for now, and we hope you enjoyed the show. Join us next time, won't you, for the Clarion Call. Until then, I'm Janice Liggins. Blessings to you.